Total number of cases, 74,194. Total number of tests, still up over 1.5 million, 1,552,667. Currently hospitalized, 592 Kentuckians. In the ICU, 150. On the ventilator, 93 souls that we ought to really be proud of. Test positivity rate is still
I have more, right? I have more orders?
Yeah.
Okay.
That's going to be impacted really quickly if we keep having this many.
Can I have a thing for the drink? Can I have a thing for the drink?
Jefferson, 190, Dade, 185, Preston, 31, Davis, 28, Laurel, 24, Madison and Whitley, 24, Henderson, 22, Pike and Warren, 21, Scott, 20, Callaway and Knox, 17, Bullock, 14, Carter and Shelby, 13, Franklin, Lincoln, Nelson.
Thank you.
Have a good day, ma'am.
You too.
Lisa Schultz of Somerset, who brought us a quilt that is here in the rotunda that has some real special meaning. This quilt was made from 100 mask makers from all over Kentucky, and these are scraps left from masks that they were making, that there wasn't enough material to finish off that mask. You will see in this quilt pieces of masks that either the First Lady or I wore, never even knowing that they were made by one of these 100 individuals. They are from communities all across Kentucky. The Kentucky Mask Makers Quilt is intended to mark a moment in our history where Kentuckians came together to do what was needed to help one another stay safe and get through this difficult time together. This is symbolic of 100 people who saw how much a mask can help people and got to work. They didn't complain, they didn't push back, they didn't talk about it being inconvenient. They took their own time to protect their fellow human being, not just by wearing one, but by making them for everybody. You know, there's lots of different reasons to wear a mask. Today, I'm going to wear a mask for these 100 patriots. We talk about heroes, we talk about patriots. How about those that are ensuring that everybody out there can have a mask to stay safe? With that, I'm going to turn it over to Dr. Stack, and then we'll come back and answer questions.
Thank you, Governor. Good afternoon, everyone. Today I'll go back to a little bit more my normal style. We could do my slide. Thank you. You've seen these before. This is from 91-divoc.com. This is a neat graphing website. Arizona's in the orange, Kentucky's in the blue. Arizona obviously got hit hard in the summertime. Arizona hit a peak of about 550 cases per million residents per day. Kentucky had a low plateau around 40 to 50 a day for about 3 months. Then it had an increase. We warned people about that, and then we steadied in at about 150 cases per million per day for a couple months, and now we're in a new escalation, and we're now up at about 200 cases per million per day. And I've raised the concern that when you're running at higher levels, you take off more quickly, you're at a worse starting point, and so the badness can get bad more quickly. The reason I'm going to do this is I'm going to show you a new study here that came out today, again, from the CDC. Again, a wonderful resource at its best. So if we can show the next slide, please. So the CDC showed today that when they started having their escalation in the summer, you just saw that huge mountain on the previous graph, they had a marked increase in cases. They immediately took actions and took steps. When they took those steps, they had predictably in the weeks and months that followed a profound decrease, a 75% decrease from that peak in their cases. I'm going to show you on the next slide a graph that shows more detail. You won't be able to read these words from home, but I'll just tell you. On the far left where you see the tiny little bars, that's when they had stay-at-home orders. That's back in the spring when we did healthy at home. We know if we keep people apart from each other, infection can't spread. This just proves that. So they had the same experience there, that when they kept people at home, they didn't have the disease spread. Arizona was one of the states that opened much more quickly and much more fully when we went into the late spring. And then you see this marked surge when they started opening all sorts of retail stores at the very beginning. They were on around June 29th or so, or the end of May, where they started to have an increase. Then they lifted their stay-at-home orders and the closures expired. And that's when you get to about May 15th. And then you start to see 2 weeks after they lifted their stay-at-home orders and their closures, the beginning of their increase, just at the very base of that huge mountain that looks like a skyscraper. As they started to climb up there, when they got to the top near the end of June, and the second half of June, they put in a mask mandate, June 17th. Then they shut bars and gyms and movie theaters and water parks and limited them significantly. And then you started to see within weeks the beginning of a return to a declining trend line. They reduced restaurants to 50% capacity, required social distancing. And then halfway down the slope on the backside, they renewed their limitations in order to continue this progress. And so Arizona, can you go back 2 slides back again? So this slide that I showed here shows Arizona now is doing much better than we are because they put all these measures in place. They controlled the virus. Now the problem is if Arizona removes those restrictions, Arizona is going to face the same challenge Kentucky and other places face. They'll go back up. You can just put it back to the Team Kentucky slide. So my points in showing these slides are, we know what works. I know it's fatiguing. I know that the public's tired with this, but it's a disease that spreads predominantly by droplets, also perhaps by some aerosol spread to some extent, and that was finally acknowledged by the CDC again in their public documents, and also perhaps by touching some things, although that's by far the least of these. We have to take steps to keep ourselves away from each other and to reduce how we're spreading things. Now, some will say, well, there's not as many hospitalizations now as there were per people sick. Well, there's a number of things. First of all, when we were healthy at home, young people were largely at home. They weren't exposed to each other as much. We've got schools open, we've got colleges and universities open. We have all of industry and society open, even if at reduced capacity. People are interacting a lot more than they did before. A lot more younger people are also getting sick now, are infected, and they don't have the same severity or acute severity of disease as the older folks and folks who have chronic medical illnesses. So that would, right there, would drive down the mortality and the hospitalizations. The other thing, there's more discussion that maybe wearing these masks has another benefit, which is if you infect somebody, maybe you transmit a smaller amount of virus to them and you get a smaller dose, and then perhaps the severity is not as bad. So if you're around someone with a big viral load spreading lots of virus in the air, you breathe in a big dose, you get a lot more, if you will, toxin or infection. You could have a much more quick surge in your illness potentially, and you could get worse and have a much worse course. We don't know that for sure, but that's one of the theories people are postulating. So I want to leave you with this thought here. So I've said before, I'm an emergency physician. That's what I've done most of my career. It's only recently when I took this job that had to be on pause because this takes too much time right now. I care about the patients I treat and I take care of in the emergency department, and now as I serve as a health commissioner for the state of Kentucky. I really do care, and I want everyone to have the best chance. But please don't misunderstand caring with not understanding and accepting. People are going to make choices, and bad things may come their way. The challenge here is there are a whole lot of Kentuckians, and I'll just tell you, my sense from the communications I get is well over half. It's not close. It's well over half of Kentuckians who are very concerned about this virus. They understand things like the flu killed 22,000 people last season. COVID has already almost killed 220,000. Any way you extrapolate into this, this disease, COVID-19, is at least 10 times more fatal. At least 10 times more fatal than influenza. So more than half of Kentuckians, I'd say more than half of Americans understand it's a dangerous disease, it's risky to play games with it, and they value their lives and they don't want to lose it. So until we find a way to protect all those people from the actions of others, we have to take steps to give everyone a fair shake so that they don't get unwillingly taken down by this when we could have taken steps. Now, if we get vaccines, and vaccines give everybody a chance to be protected if you get the vaccine and stay safe, we're still going to urge these things if they need to be done. But if others endanger themselves and pay a consequence for that, that's your choice. And I'll sleep. But I want to give you and everyone, we got to protect the supermajority of Kentuckians and give them a fair chance. So again, I want to ask you, please, wear the masks, socially distance, and follow these other guidelines because they're really simple and they're really low tech, but they actually really work. And if we do all this together, that's how schools stay open, universities stay open, businesses stay open, and people get back to activities. I've said in some of these tweets, people are good people and want to be heroes in their own life, want to be a hero in their own life story. So be a hero, dress like one, wear a mask, and you hope keep other people safe, and you'll keep yourself safe at the same time, because this thing's like a boomerang. When you take your eye off, it's going to come back and hit you in the head, and so many are going to face a consequence through your own actions because you didn't wear these. So please try to avoid that. Thank you.
All right, we will open.